Hello, my name is Abigail Manning, and I am a freshman student of nursing at the University of Michigan. I obtained a health assessment on March 25th at 11:03 a.m. To maintain confidentiality measures, I will refer to my patient as Mr. B. He is a 65-year-old Caucasian male who is married. He's worked in a factory for 40 years and is currently retired but occasionally works part-time for his neighbor. His usual source of medical care is the VA in Ann Arbor, Michigan, even though he resides in Ohio. His vital signs were as follows: heart rate 110 beats per minute, respirations 20 breaths per minute, and blood pressure 145/83. His primary reason for seeking care was as a result of an infected lesion 5 inches wide and 5 inches long on his posterior neck column. He complained of severe pain in this region. Mr. B is currently on several medications. He takes phytonadione, morphine, lisinopril, metoprolol, aspirin, nitroglycerin, heparin, acetylcysteine, insulin glargine, insulin aspart, piperacillin, vancomycin, and ibuprofen. Mr. B first noticed the infection 3 weeks ago when he awoke from sleeping. The infection is 5 inches across on his posterior neck column. The exterior premise of the infection is red and dry, followed next by necrotic skin that is about half the size of the reddened skin. At the very center is 3 to 4 swollen pustules. He reported being in constant pain and came into the VA last week for a small procedure where they then drained the pustules. The pustules soon filled again, and at 2 a.m. on March 25th, he came in again because he was experiencing unbearable pain. The client did not report trying to alleviate the pain and had no associated symptoms. He perceives the problem to be semi-serious. The origin of the patient's infection is unknown, but his past medical history demonstrates that he has type 2 diabetes and a heart murmur. When reviewing Mr. B's integumentary system, I inquired about the onset of the lesion, and the client responded it appeared 3 weeks ago when he woke up and felt a bump after sleeping. Since then, it was increased in size progressively. He reports the intensity of pain as a 6 out of 10 with no itching. The surrounding area of the infection is reddened and dry, followed by necrotic skin and pustules. It takes about 2 days for the pus to accumulate after being drained. The client does not report being in the sun for long periods of time. He does not use sunscreen, and he has no other skin conditions of concern. The only change reported in his hair, nails, and skin, despite the lesion on the back of his neck, is that of his hair grain at age 21. Upon reviewing Mr. B's cardiac system, he reports no past history of chest pain or arm and jaw numbness. The client does not have a history of heart disease or hypertension. However, he does have a heart murmur in the pulmonic valve. He has not experienced any change in exertion, tolerance, or fatigue unrelated to his increased age. He reports being able to walk as far as he wishes without becoming distressed. Despite this, he does find that getting up is difficult. He cannot lay on his back and sleeps on his side with one pillow. He does not report having any heart palpitations. After carrying out a cardiovascular exam on Mr. B, I found no thrills, heaves, or lifts upon inspection or palpation over the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. The client's contour of his chest was normal. All of the previously listed areas were auscultated with the diaphragm and bell. A murmur was heard over the pulmonic area. S1 was heard best over the mitral and tricuspid areas, and S2 was heard best over the pulmonic and aortic areas. No S3 or S4 was detected upon auscultation. These are my findings upon performing an integumentary exam on Mr. B. I observed an appropriate skull size and shape with no abnormalities such as lesions or scars. I inspected the patient's skin condition and recorded no obvious facies. His body was symmetrical. He had a few age spots on his face, and his coloring was congruent with the rest of his body. I found no abnormalities upon inspection of the patient's eyelids, eyelashes, conjunctiva, sclera, cornea, and iris. Also, I found no abnormalities found upon inspection of the lips, facial structure, buccal mucosa, teeth, gums, tongue, floor of mouth, hard and soft palate, and posterior pharyngeal wall. No lesions or scars on head, face, chest, or extremities were found as well. He does, however, have a lesion on the posterior column of his neck and a scar on his abdomen from his appendectomy. His equal coloring and hair distribution across his body. There is graying and thinning of hair located on his skull, but no flaking or lesions. Hair texture appears to be silky. Texture of his skin was smooth and not moist, as well as felt warm to the touch. No tenting was found upon turgor assessment, and no edema or tattoos were discovered. Nails were inspected and palpated to observe consistent pink coloring, normal capillary refill and adhesion, slight nail thickening, and an overall normal shape to the nail. I chose the respiratory system as a pertinent system related to the fact that Mr. B has been a smoker since he was 13 years old. At the age of 50, Mr. B quit smoking. He reported being unable to lie on his back because of the increase in pressure felt in his chest, as well as stating he felt as if his nose was being plugged. This kind of pressure or tightness in the chest is a sign of early-stage chronic obstructive pulmonary disease, a common disease that 9 out of 10 smokers attribute to their death. Mr. B has not been diagnosed with any pulmonary diseases, but it is important to continue to assess his respiratory system to detect progression of any possible lung conditions. According to Mr. B's medical history of type 2 diabetes, it is important to continue to assess his peripheral vascular system. Vascular diseases are the major causes of disability and death for individuals with type 2 diabetes. He reports no consistency in his appetite, which can lead to a poor nutritional diet. An unmanaged diabetic condition causes slowing of the healing process of infections, potentially affecting Mr. B's lesion on his posterior neck column. This slow healing process is due to the decreased amount of blood able to get to the infected location to heal it. This is my health assignment focused video. Thank you.